Welcome back to another episode of Trading Secrets. Today I am joined by dentist and founder of Shuayb Dental Institute in Tampa Bay, Florida, Dr. Omar Shuayb, the one, the only. Dr. Omar and his brother opened their practice in 2005. And 18 years later, they now own and operate not one, not two, not three, not four. We talked about it yesterday. 7 practices in Florida. Their practices offer a full scope of general and cosmetic dentistry with expertise ranging from regular dental check-ins and dental services all the way to a full set of new teeth, which I currently have. We'll talk about that. They have generated such a high level of success in the Florida market that they have tagged the official dental practice as the practice of the Tampa Bay Buccaneers. The dental field is an area we have never explored on Trading Secrets. Today, we are going to talk about the ins and outs of the business behind oral hygiene. Having an entrepreneurial mind is essential to sustain success, and hope to get some advice on that. Everyone's been asking questions left and right. So Dr. Omar, thank you so much for being on Trading Secrets.
Thank you. How you doing, brother?
I'm doing good. By the way, if you're watching this on YouTube, you can see it. If you're not, I'm going to call it the palace of Dr. Omar. I mean, this place is absolutely gorgeous, and it's starting to get me wondering why I didn't get into cosmetic dentistry. So let's start with this. The whole practice of being in this industry. There's endodontists, there's oral surgeons, there are, just specialists like orthodontics, and then there are people like you that also do cosmetics. Of all those areas, which is the most lucrative when you're thinking about getting it in from a business perspective?
By far, general dentistry, because with general dentistry, your scope of practice is open exponentially. You can do all those services that you just mentioned, by doing, taking courses, taking classes, and just, exceeding in all those areas. So I'm pretty much proficient in all those areas, and I don't refer much out to specialists unless I have to, but I do all those services you just described. If you specialize in just one thing, endodontistry, orthodontics, etc., I mean, you're focused on one thing. You can only do one thing, and it gets boring.
All right, but with like oral surgery, there's got to be big dollars behind the oral surgery.
I love oral surgery. I was hesitant when I graduated dental school from Boston University, whether I wanted to do it or not, because I do love surgery and I do a lot of surgery. But yeah, there's big dollars in oral surgery. Plus, for some reason, in a lot of states, Medicaid, I don't accept Medicaid personally, but Medicaid pays oral surgeons really well.
Okay, interesting. But in your practice, where the most, just from the business sense, the most money is made in cosmetic private pay, right?
Yes,
Okay.
In cosmetic dentistry and implants, and
Okay.
I do tons of implants. But yeah, between nose and crown and bridge and cosmetic dentistry, yeah, it's the most lucrative.
Okay. Now you own 7 practices, but I did some research and it said that dentists in the United States on average make $172,000 per year.
Mm-hmm.
So would your recommendation for anybody that is in the dental practice to definitely go out on your own and build your own practice?
Absolutely.
It's a no-brainer.
It's a no-brainer. I started out working for corporations when I got out of dental school. I mean, it's a good, head start boost, but then you're limited on what instruments you can buy. You're limited on what laboratory you can use. But by far, you make it your own.
Okay.
Going into your making your own practice.
Okay, we're gonna get into all the burning questions you guys are waiting for at home. I do want to touch into the career of the whole industry though. Dental hygienists on average, it says, make $82,000 per year. So for people that don't know about dental hygienists, What type of school do you need to be a hygienist?
All you need is to have your, if I'm not mistaken, your AA degree,
Okay.
your 2 years of college, and then have a decent. It is competitive, and then apply to dental hygiene school, and that's another 2 years, and you're solid.
Okay, so 4 years you could be a dental hygienist, and on average, $82,000 a year. Not too bad for the United States, right there.
No,
Talk to me about being a dentist. You have to obviously do 4 years of undergrad, and then where do you go from there?
4 year of undergrad, 4 year of dental school, and that's it.
Okay, so 8 years and you're up and practicing.
Done.
Got it. All right. Interesting. All right, well, let's get into some of the ins and outs of the practice and things we should know about. So another stat for you, we're big with numbers here, is that 50% of the kids in the U.S. require braces before the age of 18. Overall, do you think kids are, prescribed braces at too early of an age? Are you pro braces? What is your overall take on just braces for children?
A lot of the patients I see, they start braces too late.
Okay.
And as when you start them too late, it just gets a little bit more complex. But the earlier you start, meaning when the patient loses their primary teeth and they have all their adult teeth, and if they have crowding or spacing in the teeth, they should immediately, visit an orthodontist and have a consult. But as far as like braces per se, I don't do like the metal braces. I do Invisalign.
Okay.
A lot more conservative, does not damage the teeth, does not involve brackets. It doesn't cause calcifications on teeth, etc. So nowadays, a lot more Invisalign is being done.
Okay, so you, as a dentist, would you recommend then to get Invisalign if you didn't get braces? So suppose you're become an adult. I think I'm hearing, and I could be wrong, that if you're an adult and you need braces, and the options between braces and Invisalign, you would recommend Invisalign.
But there are like guidelines for Invisalign. Like if you have severe crowding,
Yeah.
or whatever, severe spacing, then you're gonna have to go the traditional route, which is the metal braces.
Okay, got it.
But I mean, if it's a straightforward, moderate crowding, etc., definitely Invisalign.
Okay, so as a kid, you would recommend children, the earlier you do it, the better off you are, go with braces. As you age and you have the ability within your mouth to do it, do Invisalign over braces.
Yes, absolutely. Okay. And kids know Invisalign because Invisalign requires that you wear your trays all the time, most of the day. And then you have to change them out every, 2 to 3 weeks. The trays, and kids, they lose those.
Unsustainable. You can't do it.
It's a waste of money with kids.
Okay, we talk dollars and cents here on Trading Secrets. Braces. What do you think would be a decent price point for someone to be paying for their kids' braces? Like, give me a number that you're like, okay, not bad, or give me a number that's like, that's way too much. Be aware.
Not bad. $4,500 to $5,000.
Okay.
Above 5,000, 5 to 6,000 is getting on the high side.
And in that scenario, if they're doing like 6,000, they're gonna make, that's direct margin to the office, right?
Yes.
Because in these circumstances, there's the cost of goods, there's the cost of people, there's the cost of real estate, and then everything above that is just going to be margin. So is it fair, whether it's braces or any service, do you think people should be shopping around? Well, like, obviously we talk about the car business, right? You buy a car, you go to another dealership. Do you think for services over a certain dollar amount, consumers should be shopping around?
Yes, I think they should get 1 or 2 quotes. We'll get a couple quotes. It's not going to hurt. I mean, it depends on the area you're living in. I mean, here in this area, for example, braces are 5 to 6,000. The same braces in Beverly Hills is 6 to 10,000.
Interesting. All right, well, guys, you heard that. You want some work done? Come down to Tampa Bay, Florida. You'll save a couple bucks with Dr. Omar.
Yeah, for sure.
For sure. So there's a shout out. All right, let's do this. I want to transition into the Invisalign real quick. So, how much should people be paying for Invisalign?
Invisalign between, I would say also 4,500 to 5,500.
Okay, so if you're paying more of that, be aware if you're paying less than that, well, you got yourself a deal. Okay, so Invisalign, braces, we covered it. I want to talk a little bit about just insurance in general, because there are some insurances that cover certain cosmetics based on how they're qualified. There's some insurances that have better reimbursements. Let's just talk from a consumer perspective. What are some things that we should maybe know about dental insurance that we don't? Can we get, veneers possibly qualified in certain circumstances? Things like TMJ, etc. Are there solutions around insurance? What's your overall take on insurance from just a consumer, not a dentist?
As far as cosmetic dentistry,
yeah.
If you come to me and you tell me I want, Hollywood smile, etc.
With that Steve Harvey look?
Bill Walton.
That Bill Walton look.
I mean, if you come and tell me, you wanna, cosmetic smile, don't waste your time getting insurance.
Okay, why?
They won't pay for it.
Ever. No chance.
Mm-mm. Yeah, insurance never really pays for cosmetic, smiles or dentistry, unless the teeth are, obviously severely worn down, or you got decay on them, and then that's a different story. Then you can. But as far as if you have a nice smile and there's no cavities, or really hardly cavities visible on the X-rays, then they're not going to cover.
Okay, good to know. Let's go through some services in the dental practice, start to finish, and you tell me a price point just give me the same thing, an average price point, so the consumer back home, if they hear that they're paying more, they could be aware of. One cavity filling.
One cavity filling, 150 to 200.
Okay, a cleaning.
That's a open question, because there's several types of cleanings. You can have a prophylaxis cleaning, which is the regular cleaning, pretty much a professional toothbrush cleaning at your dental office.
Okay.
That's anywhere between 50 to $100.
Okay.
And then you have like a medium cleaning, that's a couple $100, and then you can have a deep cleaning if you haven't had a cleaning in a while. That can range anywhere between $500 to $700.
Wow. Okay. So that's a big range on the cleaning front. We went over the cavity front. How about a root canal?
Again, now these things will depend on insurance, because obviously insurance will help with services like that. So I'm talking right now, if you don't have insurance, root canal on a anterior tooth, meaning front teeth, you're looking at anywhere between $600 to $800. On a molar, you're looking anywhere between $1,000 to $1,300.
Okay. All right. So that gives you some insight for the people back home. Let's talk about the insurance, though, the whole aspect of insurance. When someone does have insurance and they have a root canal and they're let's say it's an $800 procedure. Mm-hmm. How, as like a consumer, am I supposed to know what insurance covered versus what they didn't cover, and how much you charge me on top of that? Like, how does that work?
We're contracted by these insurance companies. So the insurance company, let's just say the root canal on the front tooth is $800.
Yeah.
We're contracted by the insurance company that they're going to pay us, for example, $400, and the patient should be responsible for the other $400.
The other $400. Okay.
Mm-hmm.
So if I were to shop around my root canal with another dentist, I need to ask the other dentist my all-in cost. I need to know the $800, not the $400 number.
Right.
Okay. And
mm-hmm.
because you can change that price based on what insurance will cover.
If the insurance company tells me I can only charge $800 for this root canal, that's all I can charge.
So the insurance company will tell you how much.
Yeah, we're contracted.
Okay, so they'll tell you $800.
They could tell me $500.
And you can't mark it up from there.
And then they'll tell me we're only going to pay $200, and the patient's going to pay $300, for example.
Okay, and do they audit that to make sure? Like, how did they? Suppose if they say we're only going to cover $400, why wouldn't you as a dentist just say I'm going to charge $1,200?
You can't. It's just contracted PPO fees.
Okay.
You know, they're just you can't mess with that. I mean,
and for people that don't know what PPO means, what is it?
Preferred Provider Organization.
All right, we'll talk more in the recap about what a PPO is, but let me tell you about my story. So here's my story with Dr. Omar, the one and only. You know, I go through a hard breakup and I'm thinking about, okay, what could I do differently in my life? I need a little step me up, pick me up. Well, my story before I went on The Bachelorette, I'll put a picture of it on the YouTube, but I had 2 peg teeth. My teeth were kind of a mess. I had braces, but then like they just were not cosmetically pleasing. So before The Bachelorette, I was like, all right, let's quickly get these things fixed, like 2 weeks before filming, and they did composites. So I had the composites in. Problem with composites, and we'll talk about this whole process for people that are more interested on the cosmetic side of things with your smile. They chip. They didn't last. They broke. In fact, when I was filming on The Bachelorette, we did a chicken wing eating contest in Buffalo, and I bit into the chicken wing while I was filming. My tooth cracked in half. So the whole time they filmed me, they had to film me on an angle, and I had to go to one of the producers' dentists to get everything fixed and taken care of. So it was just a mess. I've been wanting to get veneers for quite some time. So then the breakup happens, and Rob Gronkowski, as you guys know, a friend on the show, he has been on an episode, reached out. He's like, you know what you need during this breakup? You need a new smile, and I got the guy for you. And so Rob introduced me to Dr. Omar, and here I am now getting those composites fixed, and I'm doing a full set on the top 8 teeth. So I want to walk you through that whole process. For me, it was, yes, cosmetic, why not? But also functionality, because my teeth were really chipping every single time. So let's first, because I know this is where Money Mafia really wants to go with this episode, composites. They're more affordable.
Yeah,
and for
absolutely.
people that could not afford veneers or crowns or a new smile, would you recommend it? Why or why not?
I don't recommend composites. First of all, from an aesthetic standpoint, initially, you know, I'm not gonna sit here and give a time frame, but initially, and you know, over the next few months or whatnot, they might look okay, you know, polished up really well and whatnot, but they stain, they chip, obviously, and they're just not like, if you're looking to have a nice smile. No, I personally have never done it, and I don't recommend you doing composites. I mean, honestly, save the money. Even if it takes a little bit longer, save the money. And I mean, obviously come to me because it's going to be much cheaper than anywhere around. But save the money and just do regular veneers or crowns.
Okay.
And the composite stain. If you're a smoker, if you vape, if you smoke weed,
if you drink wine, if you have coffee, all that stuff.
Yeah, no composites.
No composites. Okay, so when I got my composites, I think they were like $600. They served a great purpose for 8 weeks or whatever. Problem is they kept breaking and breaking and breaking, so it's a little Band-Aid. It does not do anything.
No, it
right?
doesn't, no.
Okay, so you would not recommend composites. I think I got 5 or 6 teeth done. Does $600 sound right for composites? Or is that cheaper? What would you say? Like 4
That's
to 6
average.
teeth? Okay, $600 on average.
Yeah,
okay.
Yeah, it's average.
All right, but Doc advises against that. Okay, now walk me through. There's veneers and there's crowns.
Mm-hmm.
Didn't know the difference. Have now done a little research on it. Talk to me about what the process of veneers are and how much on average someone should pay per tooth for a veneer.
Again, it depends on the demographics and where you live, and etc. Like for veneers or crowns, I'll charge anywhere between, I don't know what, I mean, you want the hookup price or what?
No, we want that. We want your retail price for it.
The retail price for crowns and veneers is anywhere between 1,000 to 1,500 a tooth in this area.
Okay. Now, what is going to be the difference between a veneer and a crown?
I always say veneers are like, your fake fingernails that you put on your fingers. They're more prone to chipping. They're more prone to falling off. They're more prone for, a little bit more staining. The difference between the two is veneers, you shave the front of the tooth, and then, you stick these, you stick them on there, you glue them on there. Crowns, you shave the tooth 360 all the way around, and you glue them on there the same way. Crowns are a lot more stronger.
Okay.
I don't ever hardly have them. I've never, very rarely do they ever come off. Veneers, I've done thousands of veneers, and they can be annoying, and I can't, I got to be honest with you, they can be annoying. I mean, if you want something that's gonna last.
What do you mean though, annoying? Why when you say that?
Let's just say you want to bite your nails. You're gonna be afraid to bite your nails. You're gonna be afraid to bite into an apple or bite into a carrot, or just because
they're not as strong.
They're not strong.
Okay.
I mean, they're just not as strong. I mean, crowns are way more stronger, and you can. Let's just say you have some crowding in the teeth or some spacing in the teeth, and you want to close gaps or make teeth straighter. You can manipulate that smile. You can manipulate the smile much more and achieve a better result in doing the crowns, because you can shave off more of the tooth from different angles to straighten them up, for example.
Got it. One quick break. Bring the mic just a little bit closer. Like I would say, what they say is like a handful away. So like right around here. Okay. All right. So what about crowns? The cost of crowns versus veneers, should they be the same price point? Okay, so with veneers, it's more of like almost a fake nail press on. You're going to see the front of the tooth, but the back of the tooth is not adjusted. With a crown, you're going to get a full tooth front and back.
Yes.
What about this? So same price point in Tampa Bay, retail price, you come down here, let's say it's $1,500 to $2,000, so you do 8 teeth, 2 times 8, that's going to be $16,000. Let me ask you about this. I have heard that veneers from just aesthetics will look less like they are kind of like a fake tooth than crowns. Do you agree or disagree with that?
No, veneers can look very nice.
But I'm saying, will crowns look less aesthetically pleasing than veneers?
No.
They won't.
Ask Rob.
Okay, yeah, but we see Rob on Fox News. Go see that beautiful smile. Yeah, he's good. Okay, tell me about the process though. So I can tell you a little bit of what I did. By the way, got Novocaine, best Novocaine shot giver in the entire world right here. Then you drill my teeth down. Like, explain to people that are confused of what it means to get veneers. Talk just a little bit about the process if they're thinking about it.
Yeah, so basically you get numbed up. We numb you up, and then if we go the veneer route, we shave the front of the teeth down. We make you a nice set of temporaries, as Jason has some temporaries. We make a nice set of temporaries. A week, 2 weeks later, we pop the new ones in, and that's it. Same thing goes with crowns. You just numb you up, shave minimally. I'm very conservative. I don't like to take. When there's a lot of patients that tell me, "Well, you're gonna shave my tooth down to a peg or to like a tree stump or something." No, I do as minimal as possible.
Okay.
So whether it's a crown or whether it's a crown or a veneer. I mean, veneer, A little bit. You have to be a little bit more meticulous on how much you shave off, because again, there's not much retention with a veneer. With a crown, you have the whole tooth that's holding this, you know, this the whole tooth is holding the crown. With a veneer, it's just like sticks on there, just on the front. So there's not much retention.
Yeah, I think it's a really good trade secret here. You're hearing it from Dr. Omar. Go crown as opposed to veneer if you're going to get this process done. Same price, higher functionality, and you still look aesthetically extremely good. Now, for me, one of the issues is when you looked at my teeth, I had 2 teeth that functionally were literally about to break. I think someone had mentioned it. A hygienist was like, these 2 teeth were 1 or 2 bites from breaking. So I'm glad I got it done, but talk to me about this. Today I go back in the office. We're gonna actually put the new set on. So I'll show you guys some pictures out there. How long will those last me? When do I have to go back to get new crowns done?
What are you right now? How old are you?
I'm 34, I'll be 35 in a week. They'll rub it in.
Hopefully they'll last you forever.
Stop it. Forever?
I mean, pending, I see patients that I do this stuff on and they brush their teeth once a week.
Who does that?
Floss once a month. Well, they ain't gonna last forever. They're gonna, on that, circumstance, they'll last. You got to treat them like your regular teeth. You got to brush and floss. That's it. Period. I mean, I'm not saying you got to go to the dentist every month and have them clean, but I mean, they could possibly last you forever.
Forever. Okay, but veneers are not the case. That's not the case, right? Veneers, it's usually like 10, 20 years.
That's true.
And is that because they're less durable?
Less durable, less retention.
Less retention.
Mm-hmm.
Okay, got it. All right, we have some questions. The Money Mafia is our listening group. We had a bunch of questions come in, so I am just going to fire off a bunch of these questions.
Away.
Okay, so, and then we'll wrap up here in just a minute, but can Invisalign fix a crossbite?
Yes.
Okay, there you go. How much do dental assistants make per hour?
Dental assistants make anywhere between $19 to $30 an hour.
How much should retainers cost?
Retainers, $500 to $700.
Okay. I am a dentist. I would love to hear his perspective and experience with student loans. I had to take $500,000 out, and I'm wondering if it was worth it.
I mean, to be honest with you guys, I was fortunate enough to have amazing parents, to where I didn't have to take out any loans. Mm-hmm. I don't know much about loans. My daughter just graduated dental school back in May. Again, she was fortunate enough. She doesn't have loans, while 99% of her class have loans. I mean, you have to do it. I mean, if you got to take a loan, you got to take a loan.
My takeaway from it is, if you got to take a loan, take a loan. But also, once you become a dentist, become entrepreneur. Pay
that shit back.
Well, pay that shit back. Pay it back fast. But open up a practice. But become your own boss. You're going to make more than working for the corporations.
The problem is with a lot of these students that have $500,000 in loans. You come out of dental school, you have this, then you got to pay back every month. God only knows how much. And then on top of that, you're going to go open up another dental practice for another, $700,000, $800,000, and to open up another, and tack on to your loan. So it's a little bit more interesting and challenging when you have $500,000 in loans. So I would say, pay back $250 of that, loan as fast as you can, because the interest sucks.
Yeah.
And then, I would say focus on paying back your loan within the first within 5 to 7 years of your practice.
Okay.
And then
Go do your thing.
Go do your thing.
So take your education, get your experience, take the money that's coming in from big corporate, pay down your loans, be diligent with what you're spending so you can pay them down, and then go do your thing. And then you'll have a palace here like Dr. Omar.
Be frugal.
Be frugal.
When you come, yes, you probably you'll go to one of these corporations. They'll give you a sign-on bonus for $20,000 to $30,000, and and you're gonna get excited. And no, save that money. Take that $20,000-$30,000 bonus, whatever you get.
Put it towards your loans.
Keep driving your Mini Cooper.
I like that. Best teeth whitener if you can't get veneers. How do you whiten your teeth the best way? Any suggestions?
Honestly, I've always been a fond of Zoom whitening. You know, you come in the dental office and you get your teeth whitened by the light. It takes a couple hours, and that's where I've seen the best results. Cost wise, you're looking anywhere between $400 to $600.
Okay, someone had asked that. They just straight up said, do dentists lie about how bad your teeth are to get more money from you? Some?
Mm-hmm.
And how? So suppose I had a dentist that did lie to me to get more money. What are some lies they might tell me?
Bullshit lies. Like it is, they'll tell you you have a big, you have a cavity here. I've seen patients, man, here even locally from, dentists around this area, they'll come in and they'll say, this dentist tell him you need 8 crowns or 9 crowns, and then he comes to my chair and I diagnose he only needs 2 crowns.
Yeah.
I mean, they just overdiagnose, a lot more aggressive.
Bullshit.
I mean, it's just the way it is.
And so the only trading secret to then get around that would be to go get another opinion.
Go get a second opinion.
Okay, we have another one that came in. Why can my teeth, I could see through my teeth. They're transparent. I can see through them. Why?
Your natural teeth?
Yeah.
That means they're thin. And if you can see through them, that means you could be a grinder. You're grinding your teeth away, whether it's stress related, whatever it is. And I don't know the age, how old you are, but consult with a dentist. In that case, again, if you could see through your teeth, I would recommend you thinking about putting crowns.
Okay.
Because crowns are gonna
fully protect you. What about someone that asked about infection underneath the crown? Is that pretty rare? And if so, how
there's no such thing as infection underneath a crown. Decay underneath a crown, which is a cavity underneath a crown, that is possible. As I stated earlier, if when you get your when we put your crowns in and you call me, you come to visit my office a year from now, and you're not brushing your teeth or flossing and whatnot, there's absolutely a chance you're going to get decay underneath the crown. I mean, if your oral hygiene is not sufficient, absolutely, you can still get decay underneath a crown. Now, if the dentist did the crowns on you and the crowns are not sealed and done correctly, then they could cause leakage and get a cavity underneath that crown.
Okay, got it. That is good to know. I just have a couple more for you, and then we'll be on our way from the money mafia. But the next one was about wisdom teeth. This person said that they have gotten so many different price points for wisdom teeth removal. Do you have a price point, like if you get this dollar amount, that should be a decent amount?
Again, wisdom teeth removal is another thing. I mean, the wisdom teeth, if the wisdom teeth are protruding through the gums and they're showing, they're exposed, and they're easy 1, 2, 3, no insurance, you're looking at about $300 a tooth.
Oh, really? I thought it'd be way more than that.
Mm-mm.
So you get 4 wisdom teeth done, somewhere between that $300 to $400.
Again, as if they're exposed and whatnot. Now, if they're impacted and buried below the gum or buried below the bone, obviously price fluctuates by a couple $100.
Okay, got it. Good to know. And the last one we haven't covered is TMJ. What solutions do you think that people should pursue for TMJ? Does insurance cover any type of dental work on TMJ?
Yeah, I mean, again, the insurance cover, yeah, it'll help with TMJ. But now, again, a lot of a lot of people out there say my TMJ. It's not really TMJ means temporomandibular joint. So we all have TMJ, temporomandibular joint. It's called TMD, temporomandibular disorder, where you have problems in your TMJ, meaning clicking, locking your jaw, pain, arthritis, and a lot of those disorders in the temporomandibular joint are resolved by a night guard, a bite guard, and what we call an anterior deprogrammer to relax your temporomandibular muscles. But as far as like fixing TMD via surgery, I highly disadvise from that.
Okay.
Because your TMJ will never be the same again.
TMJ will never be the same again. So you would recommend one of the guards, and how much do the guards cost?
Honestly, between $300 to $400.
Okay.
I do them for almost all the football players, just because of what they do, and they're always grinding and whatnot. So I do them all the time.
Okay, last question I got for you. You have done dental work for a lot of celebrities. You've done dental work for a lot of football players, hockey players, a lot of people out there. He's the best in the business. Dr. Omar, we'll put all his contact information in the show notes, so go check him out. Who's been the biggest baby in the big seat? Who's been the softest? Who's been the most scared when they come in getting work done?
The worst. Ooh, that's a tough one. Mike Evans. Sorry, Mike, if you
Sorry, Mikey.
He was sweating his balls. Rob.
Was Rob nervous?
Rob, he was nervous until I calmed him down with a couple puffs.
That's unbelievable. The best part about that is Rob, think about how many back surgeries he's had. He's been hit from the hardest people in the world. He's worried about a little needle coming in.
Yeah, they all hate the needle, but you seen the needle. It was pretty good.
It was good. I had a Xanax, but I didn't give a shit. I was like,
yeah, you did.
I was like, hit me, baby.
You did really good.
But this guy right here, Dr. Omar, is one of the best in the business. I'm excited to get these teeth done. I will show you on the YouTube the before and after. You can go to the Trading Secrets podcast page. You can see the before and after. It will all be there. And you could reach out to Dr. Omar, and he'll tell you where. We'll get his trading secret. And also, stay tuned. We are working on a giveaway. If you hear veneers, if you hear crowns, and you are saying to yourself, that is something I've always wanted, we are working on giving a free set away. It's not finalized yet, but when it is, you'll want to make sure that you are following Dr. Omar, you're following us in Trading Secrets. So more to come on that. We have to end with this. It's a trading secret. It's the name of the show. It's something that people could only learn from you and not from anywhere else as it relates to either being a consumer in the dentist industry, working in the dentistry, anything that we should know about the place and space that we don't know that we can only learn from you. Trading Secret with Dr. Omar. What can you give us as consumers?
Trading secrets, I would say, if you go visit a dentist that looks, whether it looks qualified or doesn't look too qualified, always get, I would say, a second opinion and a second quote for the services needed, because it could be minimal, but a lot of times it could be very worth it, well worth it. Probably save quite a bit of money. So I would always get two opinions and two estimates. Always, and visit the dentist at least if you don't want to get a cleaning every 6 months, visit the dentist once a year. Get a cleaning at least once a year. Obviously, we always say every 6 months. For those kids out there, take them, have a orthodontic consult by your general dentist or by the orthodontist as soon as they lose their primary teeth and they have all their adult teeth. Have them evaluated for braces or whatnot. Just stay on top of it, man.
Yeah, it sounds like the more proactive you are, the better off you'll be. The earlier you do things, the more consults, the more that you.
I'm gonna be honest with you guys. When you for every person I've ever met, the first thing I look at when I talk to them, sit with them, etc., whether it's a business meeting or whether it's just for fun or whatever. First thing I look at is a smile.
Yeah, it's true.
And in their breath.
Yeah. All right. Before I wrap, best thing you can do with your breath.
Best thing you can do with your breath? Brush, floss. There's so much bacteria that accumulates in between the teeth that causes bad breath. Not only is it on your tongue, brush your tongue, obviously, but that bacteria always sticks in between the teeth and on your tongue. So make sure you floss and brush and use, a good mouthwash, and you'll solid.
Be good to go. All right. Well, I do have coffee breath right now, so hopefully you can't smell it from here. But Dr. Omar, thank you for being on this episode of Trading Secrets. Where can people find everything about your practice, your Instagram, everything? If they have questions for you, where can they come?
Instagram.
Which the handle is?
What's the handle mean? The fuck?
So if someone wants to type your name into Instagram, what are they typing?
Oh, I don't know. I don't even know what my shit is.
If that's not a doctor and dentist, I don't know what is.
What the fuck is mine? Dr. Omar 23.
Dr.
Omar 23.
Dr. _Omar _23. You can ask him all the questions. This guy has 300,000 plus followers. He is in the game. He's working with the big celebrities. He gave you information, trading secrets that dentists are not providing you as far as school, braces versus Invisalign, TMG, TMJ, TMD. We heard all about veneers versus crowns, what I'm going through. So I'm telling you, it's been one of the best experiences I have had with Dr. Omar. Go to his website and check out and wait for this giveaway. We're going to do something really cool, and it starts by following him. So, Dr. Omar, thank you for being on this episode of Trading Secrets.
Thank you, my brother. I appreciate
awesome.
you. Thank you.
You are the man.
You're
changing smiles by the day, baby.
Thank you. Love you guys.
Thank
you.
While making a shit ton of money while doing it. Thanks for being on.